My name is Meg Kellenberger and I'm 22 years old. I am a student at Samford University, and this is very important to me because as a person with a disability, I realize that it can be very difficult when transitioning from pediatric to adult care, and that is one of the reasons why I have decided to share these tips with you. There have been multiple problems associated with transitioning from healthcare, and there have been multiple reports done on it. I know personally that there have been some issues transitioning from adolescent to adult care, and we hope that this video will be very helpful in identifying some of the steps that you could take to minimize the gap in the transition between adolescent to adult care. Most planning should start around age 12, and you should talk with your doctor about the best ways to make a transition between your pediatric health care and your adult health care. This video will give you a couple of tips to maybe help you talk to your provider about the ways that you can transition from your current health care as a child to your health care as an adult. To best prepare adolescents to take control of their care, there are several different steps that you can actually take as your child is getting older to best prepare them to take control of their care. One of those would be to request that parents or caretakers wait in the waiting room while adolescents are being seen by the doctor so that they are able to express their concerns to their doctor in a way that makes them comfortable with owning up to their health care by themselves. And this is very empowering to a lot of people who are trying to make that transition themselves, to be able to talk to their doctor on their own and really understand what it means to take control of their healthcare needs. One of these things that you can address with adolescents is privacy and consent. Doctors should talk to adolescents about the facts that anything that they share with them in their appointment is confidential and will not be released to their caretakers without their consent. It's very important that they realize this and that the doctors are able to clarify that the only way that they would be able to express any of the things that have been said in the doctor's appointment would be if they were threatening to hurt themselves or someone else. Each adolescent should have an understanding of the following things about their health care: their diagnosis, their previous medical history, anything that their family has been exposed to or has had in their medical records, so family history, and their allergies or anything that their previous health care provider knows in their medical records that is pertinent to their current health care provider. Patients should also be familiar with how to schedule appointments. I know that this has been a real thing for my family, is the ability to make your own appointments. It is really important that doctors speak with adolescents about scheduling appointments for themselves. It might be helpful for adolescents to have a handout given by their doctor that says their doctor's name, their doctor's address, and any other pertinent information with scheduling appointments or the ways that you go about the transition from pediatric to adult care. Here are a few helpful tips that pediatric physicians can use to help their patients transition from pediatric to adult care. One is to help patients understand a list of providers that could provide them with the care that they need. This could be referring them out or giving them contacts to other adult physicians in the area. Also, it would be helpful if the pediatric healthcare provider follows up with the adult healthcare provider after the patient has had their first appointment. The adult healthcare provider should also be aware of any complications that the patient has had in their care previously. This could be with their family members or with complying with treatment programs or anything dealing with their healthcare needs that has been an issue in the past. Nutrition is also an important component in healthcare. The pediatric healthcare provider should also pass along this information to the adult healthcare provider, and this could be just their general nutrition status or whether or not they've had any more advanced problems such as diabetes or insulin resistance, and also just their general BMI and nutrition status. Physical activity habits are also an important thing to pass along to the healthcare provider. Any general physical activity that the patient does should be known by the healthcare provider. Resources should also be made available to the patients so that they would be able to take care of their physical activity needs and have all the resources that they need in order to be as healthy as possible. Oftentimes, adolescent patients have used or need to use the services of a psychologist or a social worker. This can be very beneficial for the adult physician because it will allow them to realize the barriers in the transition from pediatric to adult care. It is important for physicians to realize the resources that are available in the community to allow the patient to use the services to make the transition easier. Another thing that would be useful for physicians to know is the social past of their patients. Any kind of social barriers that have impeded the patients in the past that would not be noted in their file should be addressed with the patient and the physician. The physician should also be aware of the community resources to allow the patient to make an easier transition from pediatric to adult care. Preparing for transition into adult care from pediatric care can be a time-consuming process, but it is necessary for the patient's proper care. If started early, this could really ease the transition process from pediatric to adult care and be a lot easier on the physician and the patient as well. Ensure that the patient has a copy of their medical record from the doctor, and that will also speed up the process of transitioning. The information that we have shared with you in this video is what we have considered to be most important. However, it is by no means an exhaustive list of things that will be helpful to you. Each individual is different, and the transition process is different for each person.